Good day, I'm RinaMunirahBulqini from Department of Dermatology and Venerology, Universitas Jenderal Ahmad Yani. This is a great honor to be given this opportunity and to be able to present a study result in this special event with the title Topical Effect of Curcumin Extract Gel toward 2.4 Dinitrochlorobenzene Induced Albinomized Epidermal Thickness. As the introduction, skin is an integument of vertebrae that provide a physical barrier from outer environment and protect the body from physical damage due to desiccation, overheating, irritant substance, chemical, and biological exposure. Increased exposure of these factors might precipitate skin reaction, including skin inflammation, irritation, allergy, and even cancer. Inflammation is a protective immune response toward various pathogens that cells and irritative substance and closely regulated by the host. Inadequate inflammatory response might oppose risk persistent pathogen infection. Meanwhile, excessive inflammation might cause chronic inflammatory disease or systemic inflammatory disease. Even though inflammation is a body defense mechanism, complex incidents and involved mediators in this reaction may induce or complicate various diseases. Thus, the anti-inflammatory agents are highly valued in treatment of pathological inflammatory response. Topical corticosteroid is the first-line therapy for various inflammatory diseases on the skin. However, prolonged use of the topical corticosteroid opposes local side effects, systemic side effects, and might induce skin atrophy. So, availability of topical anti-inflammatory with satisfactory efficacy and with minimum side effect is highly necessary. So the aim of this study was to determine the effect of topical curcumin extract gel applications in various concentrations toward epidermal thickness of albino mice induced with the NCB exposure. 30 samples albino mice divided into 6 groups. Group A was the control group without treatment. Group B was treated with once the NCB application, and on the next 3 days, biopsy was obtained and histopathological examinations was conducted. Group C was treated with the NCB application. As soon as the NCB was applied, base cream was applied. The treatment was repeated on every 12 hours and then 72 hours after the NCB induction, biopsy and histopathological examination were conducted afterward. Group D was treated with the NCB application, and as soon as the NCB was applied, 2% curcumin extract gel was applied. The curcumin extract gel application was repeated on every 12 hours, and then 72 hours post the NCB inductions, biopsy and histopathological examination was conducted. Group E was treated with the NCB application, and soon after the NCB inductions, 4% curcumin extract gel was applied. The curcumin extract gel application was repeated on every 12 hours, and then 72 hours post the NCB induction, biopsy and histopathological examination was conducted. Group F was treated with the NCB application, and as soon as the NCB was applied, 8% curcumin extract gel was applied. The curcumin extract gel application was repeated on every 12 hours, and then 72 hours post the NCB induction, biopsy, and histopathological examination was conducted. Here are the results. ANOVA test result, as seen on the table, show that there was no significant difference regarding the mean epidermal thickness among the 6 groups. This result was different with study result by Hyo et al. In 2017, which showed that in histopathological examination using hematoxylin eosin staining, the NCB may induce epidermal and outer dermal thickening. This was probably due to difference in application of the inductor, and moreover, different in the study result could also because the epidermal thickening occur in irritant contact dermatitis, especially chronic irritant contact dermatitis. Here are the epidermal thickness as seen on histopathological examination. Interestingly, in this study, it was observed that the mean epidermal thickness on the group that was treated with 2%, 4%, 8% curcumin extract gel or group D, E, F were slightly higher than on the induction group or group B and control group or group A. This was because curcumin was a potent antioxidant, anti-inflammatory, and anti-infection, which plays a role in wound resolution process. Topical curcumin was effective for various conditions associated with injury and inflammation on the skin. The main mechanism of actions was the ability of curcumin to inhibit phosphorylase kinase enzyme. For the conclusion, there was no significant difference in mean epidermal thickness between mice group that were treated with curcumin extract gel with mice group that were not treated with curcumin extract gel. Further research is recommended to determine the anti-inflammatory effect of curcumin extract gel for chronic inflammations and to determine the anti-inflammatory effect of curcumin extract gel with novel formulations. For example, in examining signal pathway of an F-kappa beta activity. Thank you.